Hello, and welcome to Revelation's webinar this month on inflammation, the root of ill health and disease. So today we're going to be talking about different nutritional tools we can use to help dampen that inflammatory fire. My name is Baylor Rice. I am a pharmacist and one of the clinical liaisons on the Revelation corporate team. So welcome, sit back, relax, mute your phones, and get ready to hopefully enjoy and learn something a little bit new about what we can do for inflammation. So to first talk about Revelation, we are a network of pharmacies, compounding pharmacies across the United States. So my name is Baylor Rice. I was the owner of South River Compounding Pharmacy in Richmond, Virginia. And we became part of a member of the network with some of my colleagues across the U.S. So if you're wondering who this person is, you don't see me in your particular pharmacy, that's why. We all kind of network together to make us all better and share ideas and learn from one another. So what we are is a compounding pharmacy at the core, really. Some of the pharmacies are sterile and non-sterile. Some are just non-sterile. Sterile are the things that have to be made in a sterile environment for typically injectables and things like that. We do specialize in natural medicine, vitamins, minerals, herbals, homeopathics. We do consultations, personalized consultations. So you can set up a time with one of our nutritional consultants, go over your lifestyle, your family history, personal history, disease states, any labs that you may have, and really put together a very personalized protocol for you to go and help achieve what I refer to as optimal health, because that's really what it's all about. What we can do to get the bar as high as we can for as long as we can. Trained in natural medicine and functional integrative approaches, so use a whole variety of different tools to help me assess patients, from saliva, urine analysis, hair analysis, stool, neurotransmitters, micronutrients, etc. So we'll use whatever we deem necessary to help each particular patient out. We also have an agreement with a company called Ulta Lab. So if you're having a hard time getting blood work done, you can go to the site here listed, southriverrx.com/ulta-lab-testing/ and that'll give you the ability to order whatever blood test you want or need. So to get into today's presentation, I figure I'll take a moment and just kind of talk about inflammation itself for a moment. Certainly it's critical for our survival. But excessive inflammation is what linked to chronic disease and ill health and ultimately death, right? When we think about the number one cause for death in the United States, cardiovascular disease, right? And when you peel back behind that, what is behind that? Inflammation, ultimately. So when you think back to certainly ancestor times, and I'm trying to write on my board and it's not letting me here, to where, we were exposed to things. We'd go out, forage for food, whatnot, not we, because I wasn't around at that point, but certainly our ancestors. And you would, if you're going after something at that point, certainly if a predator came after you, a lion, and chased you, it was that cortisol that was kicking in, right? That would help you be able to get away from that situation. Otherwise, if the lion, for instance, ate off your arm, whatnot, then it was that cortisol and adrenal response that shut that down and released chemicals in your body to help handle that inflammatory process going on, both from the wound healing piece, fighting the infection, etc. So certainly we've come a long way from caveman time. Now we have all of these other modern life conveniences, but yet are adding to our burden of inflammation. Certainly all the different pathogens in our environment, the food or lack thereof of quality food, certainly all of our environmental toxins, stress, right? We tend to go. All of that is just layering and adding on to the whole inflammatory process. So what we're going to do is kind of talk about what we can do that, so when we have an inflammatory response, what we want to do, it's okay for inflammation to happen, but we want to do something to help resolve it and ultimately get rid of that inflammation versus the inflammation just going and staying. That's what's going to help lead to tissue damage, organ damage, really chronic disease, if you will, within our system. So uncontrolled chronic inflammation is linked to many chronic disease states. So from diabetes, obesity, pancreatitis, asthma, Alzheimer's, autoimmune disease, arthritis, inflammatory bowel, as I mentioned earlier, cardiovascular disease, and certainly mood, right? So that's a lot of things going on. So certainly some key nutrients for modulation of the inflammatory process. Certainly anybody that's seen one of my webinars or lectures in person, you know, I'm a huge advocate of omega-3 essential fatty acids. Fish oils helps everything absolutely head to toe. There's a hops extract, tetrahydroiso alpha acid, that does an amazing job of helping to lower inflammation. Curcumin, Xantha humal, Boswellia, ginger, certainly cannabinoid, CBD, the list goes on and on. So we're going to focus on a few of these today and kind of give you tools in your toolbox, if you will, that can help you, whether it's a chronic condition as well as kind of the weekend warriors, if you will, that as we get older, we go out and do things and kind of overdo it on the weekend and kind of paying for it on Monday. So first, we'll talk about the hops extract, THEA for short. Certainly in models and in research, helping to reduce swelling, reducing arthritis index, decreasing joint damage, decreasing cartilage degradation, helping to decrease bone erosion, and also reducing interleukin-6 levels, which is another marker of inflammation. So what's nice is in practice, I see a difference with my patients with this. And then also in research, we see it make a difference in the numbers and data, which is nice. And here's some of that illustration here, helping with decreasing that joint discomfort, as well as helping with joint and muscle complaints over a 12-week time period. So our answer to that, and side note, these are do have South River on them. We are working on getting things switched over to the Pharmacist formulation brand. So soon this will be available in that. But until then, this is what we have is by South River. Joint complex, it is a combination of a type 2 as well as 1 and 3 collagen protein, 20 milligrams per tablet with 300 milligrams of the iso alpha acid hops extract. So what's nice about this product is think about osteoarthritis. So, right, the more we use our joints and the more we have that bone on bone and pounding. So those of us that have done a lot of running or tennis, things harder on the joints, it's like a shock absorber. We're going to wear it out in time. So this is doing two things. The cartilage extract in here is helping with rebuilding that cartilage. So as on the previous page, helping to decrease that joint space, and then the hops extract decreasing the inflammation. So it's kind of two products in one, if you will. Dosing on it is 1 tablet twice a day, so it does make it easy. You can do one at breakfast, one at bedtime. Currently, that's how I do mine. I've got 2 different little pill boxes that I've got AM on one and PM written on the other, so it makes it nice and easy. Our triple joint support formula, this is a combination of yeah, I guess your gold standard glucosamine sulfate. Now, I do want to mention that there are other forms of glucosamine out there. Sulfate is the molecule that does tend to get absorbed the best. So, also, that is combined with chondroitin sulfate. Our chondroitin sulfate is less than 14,000 Daltons. It's very important because a lot of chondroitin sulfate really molecularly, the size of it, it's too large and you don't see absorption from it. So this one is the right size. So we've got a combination of the glucosamine, the chondroitin, as well as the methylsulfonylmethane, the MSM. So that's helping with that cartilage. MSM is also helping with the inflammation. So again, think osteoarthritis, the aging joint. So that's if someone comes into me, for instance, personally, I started taking things for my joints when I was 35 because I started feeling it then. I've been hard on myself and still haven't slowed down. And part of the reason why I think I haven't slowed down as much as I have is because I've been taking something for my joints for the last 20 years. So this great place to start, right? Versus if we go back to the joint complex, this one more if you've got that discomfort, but you've got that daily inflammation and kind of pain involved, that's where I'm going to graduate and go to the joint complex, right? So we can get and squelch that inflammation down at the same time while we're working on the cartilage. Otherwise, somebody that's starting to see a little bit different, starting to have some aches and pains, and or, hey, Baylor, I'm a runner, or, I'm hard on my joints. What can I do so that I don't have issues later on, and or we push back, when we do have issues, ultimately is what we're doing, right? That's where I'm going to start with the triple joint, and then 2 capsules twice a day. Next, we move into the advanced joint support. So this I would say is kind of a step up from the triple joint. So in here, we also have the glucosamine sulfate. We'll also have a little bit of methylsulfonylmethane. I'm sorry, there's a T in there. A little bit of vitamin C and manganese to help with absorption. But you also have some hyaluronic acid as well as a green lipid muscle extract. So that really does a heck of a job getting in there. So if we've started with the triple joint, that quite hasn't gotten to it yet, then I'm going to graduate up to the advanced joint. This formula is typically, I'm going to start off with 2 capsules twice a day. Over time, generally after about 3 to 4 months, find a lot of patients are able to back down to just 2 capsules a day with this formula, but I generally like starting a little bit harder out of the gate with it. So talk about turmeric, right? Everybody's probably cooked with that a little bit, or at least had it in a meal, whether or not you've known it. So curcuminoids, they're isolated constituents of turmeric root. It certainly has culinary potential as well as lots of therapeutic pieces. So some properties of turmeric as an analgesic, helping to reduce pain, including neuropathic pain in mouse models. Anti-arthritic, so it's going to help reduce that joint inflammation and help with the matrix metalloproteinase expression in mice. Anti-inflammatory, also serves as a natural potent antioxidant. So you can see in a lot of different data that also certainly from diabetes, cardiovascular, inflammatory bowel disease, serving as helping with mood. Some pretty neat data out there on curcuminoids and utilization. Curcumin, we can also combine it with a galactomannan fiber, which is from fenugreek seeds. And what that's going to do is help enhance the absorption of the curcuminoid into the bloodstream so we can really get exceptional delivery to those target tissues. And this graph kind of shows you what a standard curcumin extract versus binding it, what that will do to absorption. So it's really going to give you a much better bang for the buck. So that's why sometimes too, if you play Dr. Google and you go and you're looking at dosing and you see dosing is all over the realm and or hear patient testimonials on 250 milligrams did it. Well, I needed 5,000 milligrams to get to that level of relief. Again, it really matters on quality, and that's where I am very picky about the companies we deal with, and making sure we have the most absorbable products and most pure, clean, so everything's tested for heavy metals, um, as well as so things like lead, mercury, arsenic, but also uh, microbials, yeast, etc. So not just is it the right milligrams, but also looking at the purity of it and the toxins. Xantha humal. So this is an isolated constituent from the hops flower. So certainly hops, we figured out hops is in beer. Um, Lots of different medicinal uses. So we found out the hops extract has great anti-inflammatory properties, very good natural antioxidant as well. Certainly, we've seen antiarrhythmic and anti-atherosclerotic properties in animal models, helping to reduce platelet activation, anti-obesity, and glucose lowering effects in animal models as well seen reduced DNA damage. Again, protecting the DNA when we think about from an aging perspective. If you've heard me speak of that before, I'll kind of give you some thoughts on that real quick. About 65% of genetics is modifiable. So just because you may have a disease state doesn't necessarily mean that you have to get that disease state. So it's how we protect our cellular DNA. So certainly oxidative stress plays a huge role with that. So we want to limit that as much as possible. Boswellia Serrata, also known as Indian frankincense. It's a gum resin from the Boswellia Serrata tree, contains a few active constituents in this molecule: beta boswellic acids, alpha boswellic acids, essential oils, as well as flavonoids, including quercetin. Again, properties with this: analgesic, anti-arthritic, anti-inflammatory, and antioxidant. So again, another agent that we can use. Ginger root. Certainly there's several constituents in this, from gingerol, gingerdione, shogal, as well as a variety of others. Again, you're probably noticing a theme here: analgesic, anti-inflammatory, antioxidant. So all of those previous things here, the ginger root, boswellia, hops extract, the very potent ginger, right, that is combined with CGM, we have all together in one formulation, so you don't have to take 4 different things, in Flavonoid Plus. Now this, depending dosing on it, depends what's going on. So if I have somebody come to me, Baylor, I'm just in pain, I'm hurting, then I'm going to dose them 2 pills, probably even up to 3 times a day, until they start seeing relief and then backing it down. So you can use it kind of in those crux situations, and where you'd be normally going for the Tylenol or Advil types of products. This would be a great alternative to that. That certainly is a whole lot easier on the liver than Tylenol, and B, isn't going to eat a hole in the gut like your typical NSAIDs, non-steroidal anti-inflammatory drugs, which include ibuprofen, naproxen, those sorts of medications, diclofenac, etc. Magnesium. Magnesium is a fantastic essential mineral that's a cofactor in more than 300 different enzyme systems that regulate a whole diverse biochemical reaction in the body. So this includes protein synthesis, muscle and nerve function, blood glucose control, blood pressure regulation. So what we find is magnesium plays a huge role also in that muscle relaxation piece, right? It's a natural muscle relaxer. Plays a role in the active transport of both calcium as well as potassium ions across the cell membranes, which is a process that is important to nerve impulse conduction, muscle contraction, as well as normal heart rhythm. Also, magnesium is great for bone density. right? It's a contributor to bone health. It's going to help with the absorption of the calcium. So typically here, I'm going to start with a magnesium glycinate. So 1 to 5 capsules at bedtime. 3 capsules is going to yield 400 milligrams. 400 milligrams for most is kind of that sweet spot. So 3 capsules at bedtime. Why do I dose it at bedtime? Because magnesium has a relaxing effect. So it can really help with calming down at night. Now, if your bowels are sensitive, then certainly start with 1 capsule, then go to 2, then go to 3, 4, 5, etc. You can work that up. If the bowels become loose, then decrease the dose. Now, magnesium glycinate is typically one of my first go-to forms of magnesium because of that glycinate molecule. Certainly, or it's easier on the gut and less likely to cause issues with the bowels. We also have a magnesium chewable form, and this tastes absolutely fantastic. It's a berry flavor, 1 to 6 at bedtime. 4 chewable tablets are going to give you 400 milligrams of magnesium. So therefore, it's 100 milligrams of magnesium per tablet. CogniMag 3.0. Now, this hence the name CogniMag. Okay. This is a magnesium 3-8 formulation. Magnesium 3-8 is the only form that crosses that blood-brain barrier. So especially when I have my more kind of chronic fatigue syndrome patients, fibromyalgia patients, to where we've got that brain fog. And by the way, 75% of Americans are deficient in magnesium. When you factor pain into that equation, that number goes up to over 90%. So if we've kind of had some brain function stuff going on and deficiency in magnesium, then we'll go to that magnesium 3-8 form. You'd see it's available as a powder or as capsules. You either have a lemon kind of lemonade flavor or berry flavor, either one. Both I think taste great. It's a great way to kind of spice it up and do it a little bit different. If you're taking tablets and capsules for your multi and fish oil and vitamin D and everything else, then it's kind of nice to have a different dosage form in there. Vitamin D. Vitamin D, certainly it's our sunshine vitamin. Right now, this time of year, certainly we've got a lot of vitamin D going on. Certainly the synthesis from the rays of the sun is going to help convert some vitamin D. However, what we find is we are just not quite getting there. All the data is showing about 75% of US adults are deficient in vitamin D. That's huge, absolutely huge. Today, we know vitamin D is actually a hormone that plays a role in a variety of aspects of human health. It's also one of the primary nutritional contributors to the maintenance of women's health during perimenopause and menopause. So especially for our female patients, as you're aging, even more important. So it's an essential fat-soluble vitamin, acts as a steroid hormone, and plays a central role in many of the components of our skeletal and extraskeletal health. Certainly. So what we can do is test it, right? You can do a blood test. The range is typically for most labs between 30 and 100. So if you're greater than 30, most of the time your practitioner is going to say, hey, great, you're in the adequate range. However, optimal is between 60 and 80, especially if you have a chronic autoimmune disease. I'm going to get that up closer to that 80 side. So don't just take that, hey, I'm over 30, I'm good. No, 60 to 80 is optimal. So as kind of baseline, I use about 5,000 IUs of vitamin D with my patients a day. And then if I have a level and you're closer down in that 30 or even below range, then I'm going to crank that up to 10,000 IUs. Now, something I use very common along with the vitamin D is vitamin K. That's going to promote a healthy calcium balance in the body by performing vital functions to help direct calcium to where it's needed. Where it's needed, certainly in the bones and away from the soft tissues, right? So we want to keep it out of the heart, out of the arteries. Both MK4 and MK7 are naturally occurring forms of K2 found in the body. However, MK4 is manufactured synthetically, while the MK7 can be derived from plant sources. So that also seems to have a longer half-life than MK4. So typically in most of our formulas that I put together, I'm utilizing the MK7 form of K2. Bone mineralization, as I mentioned, also cardiovascular health by helping to keep the calcium going into the bones instead of in the artery. So it helps against atherosclerosis. So some options for you. As I stated, vitamin D3, 5,000 is kind of my start off point. One a day, ideally take it with fat. It's a fat soluble vitamin. So taking it with fat is going to help increase absorption. But at the end of the day, if you're having a hard time remembering, just take it whatever time is easiest. Okay. We also have it in a liquid form where one drop, you can see there's a little dropper in there. One drop is going to yield 1,000 IUs of vitamin D. So if we're going for 5,000 IUs, it'd be 5 drops, 10,000, 10 drops. Here we have it with the K2 built in. So that's delivering not only the vitamin D, but also K2, and then also the 10,000 IUs with the K2. Okay. And again, with the MK7 is what we're utilizing. So that way it's just taking one of those a day. So let's spend a little bit of time talking about CBD. I love CBD. Cannabinoids is where that surrounds. Now, cannabinoid receptors in the endocannabinoid system, you have CB1 receptors, kind of more the brain, lungs, muscles, GI tract, the organs, CB2. Ultimately, you've got head to toe, right? We see CB2 more in the periphery. So head to toe, not taught in many of the schools. I wasn't taught cannabinoids when I went to school. So certainly it's learning it outside of that, but it is responsible for homeostasis of regulation of breath, inflammation, mood, pain, sleep cycle, blood pressure, tumor surveillance, reproduction. It's responsible for over 220 systems, not just pathways, but systems of the human body. That is a lot of biochemistry going on. Now, certainly this can be activated by going for a run. You know, for a lot of people, that's going to be once you hit kind of that 6 to 7 mile mark, whereas kind of getting that runner's high, if you will. So that's releasing your endogenous endocannabinoids. These are things we have in our system today. So what happens is certainly with the toxins of pesticides, poor food quality, the oxidative stress that's happening to the body, we're depleting ourselves of our endogenous cannabinoids, thus bringing in the need for replacement, okay, and support. Dr. Raphael Mechoulam, he's one of the chemists who identified the endocannabinoid system, has stated, I can't list all the physiological systems and conditions affected by cannabinoids because there are too many. Absolutely phenomenal, right? World Health Organization on CBD. They have stated 3 huge statements. CBD is safe and well tolerated in humans. It's not associated with negative public health effects and not associated with abuse potential. So the entourage effect. So it's not just about CBD, but it's about the other cannabinoids. There are about 115 cannabinoids. Now, side note, we do have a webinar on CBD where I'll spend an hour on that. So you can go to our YouTube channel at revup.com, revcustomrx.com, and click on the YouTube link and see a whole host of previous recorded webinars there. But again, I wanted to spend a little bit of time on it today because we're talking about inflammation and pain. And this is so very useful in those aspects. So here, when you look at the different cannabinoids, as I said, there's about 115. Certainly you can go through and see analgesic, anti-inflammatory, right? And you can see that kind of over and over because the different relaxant, right? The different cannabinoids are having different effects. And so you get overlap. So some answers here. Tinctures, I'm a huge advocate of tinctures. It's easy, right? You can also titrate it up or down quite simply. I've got a lot of patients that are very, very sensitive. So you can start as low as just 1 drop, for instance, but we do have this available in 4 different strengths, 450 milligrams all the way up to 2250 per bottle. So that is more concentrated. You can see that's all per 30 ml bottle. So it does get more concentrated. So as you are having to use more of it, then typically I'll graduate the patient up and use the stronger bottle so they can get away with using less. That makes sense. We've got 4 different flavors in this, unflavored, sweet mint, citrus orange, as well as key lime. The key lime is the full spectrum flavor. Otherwise, the unflavored sweet mint and citrus orange are what's called broad spectrum. So that is 0.0% THC. You can see Boxley's Organic is USDA certified organic, one of the few CBD companies out there that have achieved this status. Very stringent testing. So, if you're worried about drug tests or anything like that, then we definitely want to use the broad spectrum. So that has 0 THC in it. We also have soft gels. Soft gels, certainly an everyday soft gel, 25 milligrams of nanotechnology emulsion in there. Again, THC free. It is broad spectrum. And then also our nighttime formula has 25 milligrams of CBD, but also CBN, which is a specific cannabinoid that helps with sleep, and 3 milligrams of melatonin. Certainly, there's also ways to do it as well with gummies. Again, this is a broad spectrum gummy, so you'll notice 0% THC, strawberry lemonade, and this provides 25 milligrams of CBD per gummy. Sleep gummies, very similar to the sleep soft gels, but you'll notice the CBD is only 5 milligrams. We went up a little bit on the CBN and 2.5 milligrams of melatonin. So, one thing about the sleep soft gels, generally that's going to give you kind of a therapeutic dose of CBD daily, unless we've had to crank it up higher, which for me personally, I generally do about 25 to 35 milligrams of CBD a day. When I overdo it too much in the yard, or here recently I broke my hand, then I slam that up to about 100 milligrams a day to really get that inflammation under control and also help with the healing process. Because as you go back and notice, certainly bone stimulant, right? Bone stimulant, you'd see it is going to help with bone density, not just from one of the cannabinoids, but a variety of them have that benefit and mechanism of action. Drink sachets, so this is kind of a much healthier alternative than your Red Bulls and that sort of thing. So you've got 75 milligrams of caffeine, 12.5 milligrams of CBD per sachet, and then there's some electrolytes and that sort of thing in there too. So great. Throw it into some water. Then when it gets to be cocktail time, you can kind of drop out some of the water and throw in your own favorite beverage there if you are of age and of the liking for that. Topically, so for me personally, when I injure myself, I'm taking the joint complex every day to help with my cartilage, taking CBD every day to help with inflammation. And then when I flare something up, then I'm going to put on some topical. Certainly the Salve is going to be the most concentrated. That's going to yield 900 milligrams of cannabinoids per ounce. Then we also have a sports cream that has menthol and eucalyptus in it. So great cooling. It's 1,000 milligrams of CBD per bottle. And then a very similar formulation to that, but unscented, right? And all of the topicals you'll notice are 0% THC, with the exception of the roll-on does have full spectrum in it. And that has 900 milligrams of CBD per 3 ounces. Pets. I'm a huge animal lover, as I think many of us are throughout Revelation. So we do have pet chews. We do have pictures. If you turn the bottle to the side, you'll see the cat on the side. So I do use them for kitty cats as well as animals, as well as puppy dogs. Separation anxiety, inflammation, arthritis, thunderstorms. Again, we can also use our unflavored tinctures as well. Dosing and delivery for tinctures, generally, this is if I start with the 900 milligram strength, I'm going to start with about a third of a dropper full once a day for about 5 days. Then increase it at another third of a dropper full for 5 days. Kind of keep increasing that up until you hit your dose response. So you get to where you want to be, right? Whatever reason it is that you're trying to alleviate, or if you get daytime sleepiness, that is the signal that you need to back off your dosage a little bit. Okay. And as well, I've got directions on how we start with the gummies. Generally, I'm going to start with half a gummy for about 5 days. And then again, after 5 days, add another half a gummy, then add another half. And same deal with the soft gels. Topical, apply as needed. You're not going to overdose with that. Just, right where it hurts, rub it in well. And then for pet treats for dogs, or cats, the pet treats are 2 milligrams per treat. So generally 1 to 2 treats per 25 milligrams per day. Or if we're using the tinctures, give 1 to 2 milligrams per about 10 pounds per day. So diet, real whole foods, trying to avoid the processed foods, really stopping those ultra processed. Those are affecting immunity, adding to the inflammation, trying to decrease the sugar and the starch. Sugar suppresses immune function, worsens viral infections, but also what does sugar do? Sugar equals inflammation. Okay, so we need to decrease that sugar, limit or stop the alcohol. Again, that's another inflammatory driver. As well, alcohol is going to deplete many key nutrients. Lifestyle changes. So certainly more fruits and veggies, more good fat, increasing the fiber. You should, especially if you're over 35 years old, you should be getting at least 30 grams of fiber a day, limiting the salt, the caffeine, the excessive alcohol, the white flour and sugar. Now, if you have an autoimmune disease, I will tell you, autoimmune equals no gluten. Okay. It's not just a fad, it's a real thing. Gluten is going to increase your inflammatory markers. Okay. When I say no gluten, I mean none. Zip. Again, that's for the autoimmune patients, of which there's over 105 different autoimmune diseases. Exercise, cardio, about 300 minutes a week. Okay. Whether you want to break that up, how, it doesn't matter to me, but I want that heart rate elevated. I want you sweating. Also pulling in some weight bearing, ideally 2 times a week for some weight bearing, daily stretching, and sleep. Oh my goodness. Sleep is so important to the system. 8 hours of straight, don't laugh on me now, straight sleep each night. Okay. Because that's where we're really going to reset our adrenal glands. The adrenals are going to have an ability and a chance to take a breather, right? So, I mean, if we're waking up, getting up, going to the bathroom, rolling over, having inconsistent sleep, then we're not dropping into good delta wave restorative sleep. Relaxing. So we want to breathe deep, do it open, do your good deep belly breathing. So everyday essentials. So I like to stress this really in all of our webinars, so you can really understand the importance. We utilize our phytonutrient multi. It is a food-based multi with methylated Bs. Now, half of the population has what's called an MTHR deficiency. So that is when it's a genetic snip in the helix where you're not metabolizing your folic acid and or your B12 properly. So in those patients, we see increase in cardiovascular disease, as well as a whole lot of different neurological things as well. So I hedge my bet. Half the population has it. I put everybody on methylated Bs. Okay. 1 to 2 tablets daily with food. We've also have capsules available with that. typically serving size is a little bit higher because you can't compress as much into a capsule as you can a tablet. So it'd be 2 to 3 caps. Pure Omega 1000 fish oils, we do have that in soft gels. Generally, baseline is 2 a day. Then if you're having more inflammation, if you have more cardiovascular issues, family history, or depression, anxiety, etc., increase that dose. Okay. We also have this in a liquid form as well. My favorite on that is our 2400 milligram, which is 2400 milligrams of EPA and DHA per 5 mLs, which is 1 teaspoon. That's so very concentrated. And you may be thinking, oh, Lord, Baylor, that's not going to taste very good. It is extremely clean. It is extremely clean. Has a slight taste of fish, but it's not overpowering at all. Keep it in the refrigerator, and that decreases that even more. Certainly vitamin D, you've heard me speak of that today. Again, my baseline generally is 5,000 IUs plus the K2. And then I will increase that depending on the labs. Okay, so have those labs. If we're not in that 60 to 80 range, then we need to bump it up. Our Boxley's organic CBD. Again, immune, inflammation, anxiety, sleep, 220 systems. I can't stress it enough how much that's hitting in the human body. So I use it in all disease states, really, 25 milligrams plus per day of cannabinoids is what we want to do to help balance our system out. So some other supplements, again, I like trying to keep things as easy as I can. So we spoke about magnesium. Generally, I'm going to start with Magnesiumglycinate if we've got some cognitive things going on, and or if we're not getting the absorption we want, then I'm going to jump that up to a 3 and 8 form. Again, either the powder or the capsules. And we also have a formula called Fibro Support that is a combination of the magnesium glycinate and malic acid. Malic acid is going to help those tender points. So we named it that because fibromyalgia. Again, most of my magnesium, you'll notice bedtime, right? It's relaxing that smooth muscle, so it's going to help with sleep. So for joints, if we've got that arthritis creeping in, certainly we can start with just the glucosamine sulfate. Generally 1,500 milligrams a day is what we're doing there. So 2 of the 750s. Or if we're already having a little bit of stuff going on, we're going to jump that up to triple support with having the glucosamine chondroitin and MSM. If that's not quite getting it, then we're going to go to the advanced formula. And if you've already got inflammation, then graduate and do the type 2 collagen with the hops extract in there, so we can hit both the inflammation as well as the cartilage at the same time. Whoops, sorry. Inflammation. Also, for my rheumatoid arthritis patients, so that is certainly some deep-seated inflammation. Ultra Inflamex 360 is a medical food. It does a very nice job of lowering that C-reactive protein as well as the SED rate. Generally, we're going to be working with those patients. Really schedule a consult because we're going to do a whole modified elimination diet, pulling out the key inflammatory foods, and then working on what else we need to do to balance the system. Again, our Flavonoid Plus has the curcumin, the hops, the boswellia, the ginger. So it has 4 very potent natural anti-inflammatories to really come in there and get after that inflammation. And again, CBD, we can do that both orally as well as topically. I can't say enough just what differences I've seen, not only with myself, but with my patients. It's been an absolute game changer. So how do we get started? So certainly starting on the baseline supplements, right? So these are things that you can go out and do today. Get started on the baseline, reset that. If, hey, you know what, I've got a little bit of arthritis in there, then let's pull in something to help with the joints. If we've got some muscle involvement, or certainly we have family history, cardiovascular disease, et cetera. You heard me, 75% of Americans are deficient in magnesium. So, ideally get that closer to 400 milligrams per night. So really we want to try to target that. So those would be some simple areas of where we can start. Certainly, you can stop by one of our many locations across the country. We can also ship all of the things I went over today. You can stop by one of your locations, or you can visit pharmacistformulations.shop and visit our online store, and we get that sent right out to you. If certainly this sounds interesting to you and you want to get deeper in how can I really make this very pointed straight for myself, and or you've got many different disease states or complex things like rheumatoid arthritis, autoimmune disease, fibromyalgia, chronic fatigue syndrome, etc., then reach out, give Allison an email or a call. Her email is patientcare@revcustomrx.com. She's our patient care coordinator, and she can get you scheduled. Again, connect with us. We've got a variety of different social media platforms out there. And here is certainly, I'll leave you with a list of all of our current locations, which we're constantly adding to. So I want to thank you for your time today. Certainly, if you have any questions, go and visit one of our local locations or give us a call, send us an email, and we'll be glad to help you. Thank you so much for your inflammation, not inflammation. Thank you so much for your attention today on inflammation. And we look forward to helping you soon and helping you achieve optimal health. So long. Have a great day. Thank you so much.